Hi, LinkedIn friends. I'm Debbie Marajian, and I hope you all are having a good Thursday. We're in the low 70s out here in Southern California, and today I wanted to talk about the topic of dementias. And dementia is just a broad term for memory loss or, impairment of judgment skills or critical thinking skills, learning and comprehending. And there's different types. There's some that impact our neurons, which is our messenger system throughout our entire body. That nervous system supplies excellent communication so that we function properly. And some impacts the cardiovascular system, our blood flow. And we'll discuss a little bit about these. Currently there's no cure, no one steadfast cure for dementia, but it has been said that exercise can aid in the way of slowing down its progression, according to the education that I have had. I've had the privilege of working with people since the 1980s. Wow. As a nurse first, and then I started my own business in 2007, and I see people after their rehabilitation period for a myriad of reasons, be it stroke or fractures or dementias and a whole host of other concerns, to keep people safe and healthy and well and avoid unintentional falls. So the first type of dementia I'm going to discuss is the most common, which impacts 60 to 80% of people, and that's Alzheimer's disease. And it affects the neurons in the brain, and it was founded by Dr. Alzheimer back in the early 1900s, maybe 1906, over there in Germany. And he looked at the brain of a lady who had a mental diagnosis, and he found these beta amyloid plaque buildups. So these little plaque buildups got into, interfered with the flow of the neurons, and they've been trying to figure out, researchers, why that happens, and there's not a concrete answer, but there has been some revealing information about an E4 allolipoprotein gene that some people have that can contribute to this, and it is a risk factor, but it's not always an attributing factor to getting Alzheimer's. So when I see people with this, I see memory loss. Sometimes it starts out slow and it's not obvious, but it will progress. There's certain scales that they use, and it helps you to gauge where the person is in the process of that. And the second type is the vascular dementia, which it packs the blood flow up in the brain. And so if there's an interruption of blood flow or a lesser amount of it, they can have transient ischemic attacks, which are known as mini strokes, that may or may not manifest into a debilitating situation, but over time it does contribute to vascular dementia. Now, if you have a full-blown stroke, an infarct where that blood is not getting to that brain tissue, yes, then you're going to have tissue death, and there's going to be some obvious telltale signs of what those manifestations are. And also there can be a bleed where the blood vessels just leak and bleed out, and also that's going to cause an interruption in that blood flow. And so what's usually seen in this is some judgment skills, or people say, oh, well, I can still do this or that, and they may not be able to do what they originally once were doing. Sometimes I see it in the speech. If that blood flow is decreased over on the left side of the brain, you're going to see this too. There's a couple of areas over there, the frontal lobe, that's responsible at the base of it is for speaking, that expressive speech. And right next door in the temporal lobe is the Wernicke's area, responsible for understanding and interpreting that information. So if they're impacted, you're going to know that, that's the area, one of the areas that was impacted by this lack of brain blood flow. And then the next would be Lewy body dementia. Actually, Dr. Lewey worked with Dr. Alzheimer's, and sometimes it's intertwined or seen. There's similar commonalities between that and Parkinson's syndrome. And they're both neurological in nature, meaning they affect those neurons like Alzheimer's disease did. And they found since Dr. Lewey identified those bodies, those plaques, it's synuclein is called. It's a type of protein buildup that balloons out and really impacts the flow between the neurons. And then there's this fourth kind where there's this mixed dementia, and usually I believe it's Alzheimer's meets vascular dementia. So you have a two-prong diagnosis going on with the blood flow and then with the neurons. So you're having memory loss and then these stroke-like manifestations. Then there is a frontal temporal lobe dementia, and again it impacts that frontal lobe and the temporal lobe. And so real quickly, there's 4 lobes in the brain. There's the frontal, responsible for executive making, decision-making processes and good judgment, and then you have your temporal lobes responsible for speech and it houses many functions in there, emotions and so forth. And then you have your parietal lobes and your occipital lobes in the back that contribute to the eyes. And within them you have all kinds of cranial nerves in there that do so many different functions. And it's just a very intense network of modalities that happen once these diagnoses are hit. And so one of the things that exercise does do is it will help in terms of, I'd say, halting the progression. There's no steadfast remedy for any one of these diagnoses. I know that there are prescription medications administered for these in an effort to try to slow the progression or help it in some way. I know that researchers are doing a lot of work to discover what other causes contribute to it and how to isolate and identify that from happening. There's a few others that I would say are, aggregate kind of diagnoses here. I've got my notes here with regard to dementia. It's a real rare type is that Creutzfeldt-Jakob dementia, which is very rare. It happens very fast, and sadly, people go into a coma pretty quickly with this. And you have your Parkinson's disease itself, which can manifest into, like I'd say, a double diagnosis when dementia hits. And again, with this, you're going to see, the gross motor skills being hit like they are in Lewy body, shuffled gait. I see the drooling. They usually get like a mask type look in Parkinson's, and there's similarities between that and the Lewy body because they impact the same part of the brain, that substantia nigra, and that is responsible for the gross and fine motor movement skills. And I think there's Wernicke-Korsakoff syndrome. The first time I saw that was in the 1980s, and these folks had spent a lifetime of drinking a whole lot. And I remember one of my patients, he could speak really well, but you couldn't really interpret or understand the sentence. It didn't make sense, but the words were articulated well. And then there's Huntington's, and I think that's a genetic-based disorder. And so I hope you all enjoyed this video about dementias. Please leave your comments below, and I would love to hear from you. And you'll have a blessed Thursday. Thank you so much for tuning in. Bye-bye.